Hello, my name is Roselle Owens. I'm the principal dentist here at D4 Dentist. I want to speak to you today about wisdom teeth. Lots of people know that you can have problems with wisdom teeth, but they're not really sure about why. So I want to speak to you about what is going on and then give you some tips to avoid it. So what happens is when the tooth is pushing through the gum, there's a flap of gum covering the tooth. And because it takes a little bit of time for the tooth to fully push through, this flap of gum is there. Now what happens is plaque bacteria and food particles can get trapped underneath that. And because it's so far back, it can be difficult to keep clean. So what happens then is it gets infected, which leads to swelling and therefore pain. So symptoms can range from moderate to severe pain. Other symptoms include bad breath, facial swelling, difficulty opening your mouth, sore throat, earache, and in severe cases you can have fever and difficulty breathing through obstructions of the airways. So sometimes the tooth is at the wrong angle to come up properly. This means that it's impacted. When this happens, the flap of gum covering the tooth may never reveal it. This means that repeated bouts of pericoronitis may happen. So it's not all bad news. There are usually simple solutions that you can do at home. Most people who have pericoronitis tend to avoid the area because they think it's going to cause more pain and discomfort. But in fact, the absolute opposite is what you should do. You need to keep the area as clean as possible. That's getting the toothbrush back there to clean it. This will remove the food particles and plaque bacteria that are causing the infection. Also, you need to do salty mouthwashes. This is putting a teaspoon or two of salt in a cup of warm water and swishing with it. You need to swish the whole cup of water, so you're swishing for about 10 minutes. And you need to do this 3 to 4 times a day minimum, but the more times, the more effective it will be. Now, if your teeth are impacted, you may need to see an oral surgeon to have them extracted. But don't worry, this can be done under local anaesthetic quite simply. Now, if you have pericoronitis, or if you think that you do, even with these simple solutions, it's a good idea to see your dentist. So now I hope you understand pericoronitis a little bit better now, and if you need any help, you can find us at d4dentist.ie, or you can come to Baggot Street and see us here directly. We'd be glad to have you here.